Yep.
Thank you so much. Regarding the looming shutdown, it sounds to me like Democrats are sort of insisting on COVID-era handouts when obviously COVID is long gone. How is that a defensible position, and why is free health care for illegal aliens seemingly the hill you guys are willing to die on?
One, the premise of your question is factually wrong, and I would urge you to actually look at the law which prohibits any undocumented person from receiving any kind of health care benefits. That is the law. If the Trump administration is not enforcing the law, then I would ask the president. And I also say the president has made repeatedly clear, and this I don't know, I often agree with Donald Trump, but on this one, he's 100% right when he said repeatedly, years back when he was not in office, you know, if you got a government shutdown, it's the president's job to resolve that. Well, you got a president of the United States, you got a Republican-controlled House, you got a Republican-controlled Senate. Let's get this fixed. Nobody wants a shutdown. And the fact of the matter is, the idea that you can punt on this question when people are going to start getting their health care increases documented this month in most states. Some are looking like they're trying to hide the ball and push it back. And then they have to sign up next month. That is not an issue that you can punt on. Our Republicans, I think many of them will concur with that, and I'll have a chance. Let's meet us halfway and get this done.
And remember, here's the programs, all the big programs undocumented immigrants are ineligible for. We're talking about Medicaid, we're talking about Medicare, we're talking about the Children's Health Insurance Program, and no Democratic budget proposal has acted to make those programs different and, in effect, make undocumented people eligible. And the reality is this is being used as a diversion because the real issue is cutting people's premiums. And we want to work with people because that's what Americans are talking about. So you make these arguments about fantasies in terms of medical policy, and on all the big programs, Medicaid, Medicare, and Children's Health, undocumented individuals are ineligible.